So I'd like to start by introducing our speakers today. Laurie Kelly is the Referral and Partnership Manager at Guide Dogs Victoria. Laurie, in his role, educates potential referrers on the wide range of services available for people with low vision and blindness. In addition to Laurie today, we will have Sally speaking, who is the team leader of the Adult and Acquired Brain Injury Orientation and Mobility at Guide Dogs Victoria. Sally has 15 years experience instructing people with low vision and blindness in the use of aids and strategies to assist her clients to navigate wherever they need to go. So I'll start by welcoming Laurie.
Thank you very much, Sabine. My name is Laurie Kelly, Referral Partnerships Manager at Guide Dogs Victoria, here with Sally Armstrong. Now, hopefully we'll have time after I say what her role is, team leader of the Adult Acquired Brain Injury Orientation and Mobility team. So thank you so much for having us. So today what I'm going to do is I'm going to give you an overview of the general services that we provide and a little bit about us, also on what funding sources are available to you and how to refer. And Sally will go through orientation mobility. You know, what is that and what does it mean for your mobility? So firstly, we're actually based in Victoria, so the services that I speak about today will be the services in Victoria. So you'd need to check your local websites as it may vary. If you're in New South Wales, for instance, you'd probably be able to get all of those services, but really wherever you are in Australia, whether you get these services from us or not, you should be able to access services of these types for low vision. Okay. And one of the reasons that we, I suppose, break down into those states is that we have local practitioners for local people. So most of our work is done, in your home, in your community, wherever you need us. So we have a mobile service. That's important to note. We're voted Australia's most trusted charity brand on 7 occasions. Now, there's a couple of reasons for that. The first one is that dogs are very cute. They are also do an amazing job, but it's also that we've provided trusted services over many years to ensure that people with low vision and blindness can maximise their independence in all aspects of their lives. Just some common misconceptions about us. First of all, we are a separate organisation to Vision Australia, but we do provide many similar services. So what that means for you is that there is a choice of providers, and that's really important to note. So, and you don't need to choose one provider or another. You can get different services from the different organisations. You wouldn't want to double up and get the same service from 2 different places, but you could have the choice, which is really important to know. Also, we are more than dogs. So whilst probably only about 30% of our services are actually guide dog related. Whilst we have an internationally renowned guide dog mobility service, that means that 70% are not guide dog related. So you might, and only a small percentage of our clients are actually guide dog handlers. So you might be thinking, look, I'm not really after a guide dog, so I'm not really, I don't think I'll call. But you certainly can, because there's a real wide range of services and so much more that we can do for you. So as I said, only a minority of our clients are actually guide dog handlers. And similarly, only a small percentage of our clients are completely blind. So our clients most have, I'll use the term low vision or maybe vision impairment. Most of our clients, what they have is that they have a diagnosed eye condition that can't be corrected by surgery or glasses. So most of our clients still have some remaining vision. What we do find is that many people go on without getting support for a long time. So we really encourage you to seek support from us. You can go to your state websites and give us a call, or go to the website and attach documents and refer through there. So you can self-refer, you can refer a family member, And of course, we also, you can get your the health professionals to refer to as well, but anyone can refer to us. But what we say is that please give us a call and seek support, because in a large majority of cases, I know that there is something that we can do. Okay. So what I'll do is I'll just go through some of these services now, remembering that this is Victoria, but check your local websites there. So orientation and mobility. Now this is, Sally will speak about this a little bit later, but this is a core service that you'll find all around Australia. And look, it really is the basis of what we do as far as mobility goes. So you'll find that it's about getting from A to B, and Sally will go into greater detail in that shortly. But in Victoria, we break down into specialised and specific teams, so we're a little bit different sometimes. So we have a specialist children's mobility service, taking children and their parents, through the milestones of life. The adult team for over 18s, and also a specialist acquired brain injury team, which is Sally's team. Now, maybe a third of our clients perhaps have low vision as a result of an acquired brain injury. So if someone's had a stroke, brain tumour, head trauma, post-operative nerve damage, hypoxia, MS, had any of these incidents, I think it's really important to have regular checks, as someone who's had an ABI may not be completely aware of the extent of their vision loss. And of course, there's guide dog mobility as well. So the cutest and furriest of all of the mobility aids. Now, guide dog might not be for everyone, but what we find is that there's really positive outcomes that can come from it. You could able to walk further and faster. You're able to have greater social interactions and the companionship of the dog as well. So look, it may not be on your radar just yet, but it may be something to think about for the future. And we have guide dog handlers that are into their 90s. So it's just about finding out what is the best mobility aid for you. Occupational therapy. So our OTs can teach you the skills of learning how to perform daily tasks with your macular degeneration. So there's many things they can do. They can look at sort of personal care, such as showering, domestic skills, like how do you cook safely and independently on your own, and community engagement as well. But there's also a tie-in with mobility here, particularly with indoors. So for instance, they can look at hazards, tripping hazards and things like that. Could be things like rugs and making sure rugs are down. There could be patterns on your floor which can be quite confusing and things like that as well. So basically they can go to anywhere in your house really, and they would look and see what might be a hazard or what might be difficult for you to do, and find an easier way for you to manage that task. So of course you tell them what you need, what you may have trouble with, and they find a solution for you. And it may be also about just simple things like color coding objects or tactile, putting something tactile in there so you can recognize the shampoo from the conditioner and things like that. So really important service there too. So also orthoptics. Now this is about eyes, not feet. So an orthoptist is different to an ophthalmologist and different to an optometrist. So our orthoptists, what they're looking at, they're dealing with not so much what you can't see, but more what you can see, and strategies on how you can use your remaining vision. So there's many different things that they could do. They can work with skills and advice on magnifiers and magnification, low vision aids, things like lighting and glare and contrast. Something that they work with many of our clients, and a key thing that they do is about reading. So not just about reading books or watching television, but make sure that you can read the ingredients on a packet. and read your bills as well. You might not necessarily want to learn, that skill, but we all have to read our bills, I suppose. But what they can do is they can set you up, make sure that you've got the right lighting for when you're reading, sitting in the best place in your house, reducing glare and making sure that you have a good light source there. So, and again, these sort of things could help you with your mobility as well. Like they will always advise that you wear wraparound sunglasses, or if you don't like that, wear a peak cap or a visor when you go out to reduce glare. So again, orthoptics is a really popular service. So we also have assistive technology. So, whether you want to use a computer, a phone, a mobile device or print, our assistive technology coordinators can come to your home or your community or wherever you need them and literally expand your world. So they can work with you on teaching you the skills of how better to use, say, your computer or laptop. Also let you know about useful mobile phone apps and how to use those mobile phone apps. Things like also teaching you in things like screen readers and also things like Braille and things like that, which still gets used as well. So you don't need to be a technological whiz to work with one of our assistive technology coordinators. They'll work with whatever level that you're at and build your skills from there. So there's so many fantastic technological solutions, if you like, for people with low vision. But it doesn't necessarily that they can advise on something that you might not know about, but they can also teach you the skills of something that you already have. So they'll teach you how to use your mobile phone, your laptop or tablet more effectively with your macular degeneration. So obviously a really popular service, and in these times where we're doing so much online, they're really coming into their own. We also have access consultants as well. So our access consultants ensure that buildings, public or private, and community spaces and things like that are accessible to people of all abilities. Now, we find, you may know that one of the things that they do is they deal with is called tactile ground surface indicators. So you might not know what that is, or may not know that term, but you certainly would have probably come across them before. So if you're at a crossing or the platform at the train station, you may notice those little plastic raised plastic circles and things like that. There can be lines there as well. So that's there to assist, someone who's using a long cane or assist a guide dog, know when there's maybe a hazard coming or where the edge of the curb is. And the lines on it can also direct where to go, things like that as well. So that's called tactile ground surface indicator, so TGSI. So remember that if you want to impress your friends. Also, support coordinators. So our support coordinators work with our clients who have NDIS funding. So, helping them navigate the NDIS and giving you, things like advice on the use of funds and giving you access to other service providers if you need it there. Also, early childhood. So early childhood is in the 0 to 6 year age group. And just like our CMS team, it's about taking those children and their families through those developmental milestones. Now, this is a relatively new service for us. So, please, if you know of someone who has a young child who has vision impairment or has low vision, or someone that works in this field, please get them to contact us, as it's a great new service. So we really have clients literally from newborns through to 100 years old as well. So that's just the services there. So what about some of the funding sources and how to refer? So we're registered to provide services through a range of government funded sources. So that includes My Aged Care, including the Commonwealth Home Support Program. Also, we can provide services within home care packages. Now, we're not a home care package provider ourselves, but the home care package provider can get us to, you can ask them to get us to provide services for you there and be covered under the funding. So I'll put the number there as well, the 1800 200 422 for My Aged Care. I would encourage anyone that's that could be eligible for that to at least apply and see how you go. So an assessor will come to you and see what your needs might be and see whether you can get funding and so on to help you with keeping you at home. I suppose my advice would be is if you are getting an assessment for My Aged Care, is don't say, oh look, everything's okay, I'll get by. Be honest about what you are having troubles with. Be honest about what it is that you want to do and what's sort of standing in your way, because you can get so much through My Aged Care, and it's not just about getting our services. There's a whole range of things that you can get. So also we're registered to provide services through the National Disability Insurance Scheme, Department of Veteran Affairs as well, TAC, work cover, and philanthropy as well, so fundraising. So this is an important point. So let's just say that you don't have any of these funding sources, the government funding sources, or you don't qualify. Then our criteria is that if your low vision or blindness is affecting your independence and safety now or in the future, and we can provide a necessary service, then we will do so. And we're able to cover that through our fundraising. So, if you are a donor of ours, I'd like to thank you very much. It's greatly appreciated, and we're able to do so much through our philanthropy. But at the same time, if you are, if you're looking for services, I would always apply for, or try and apply for some of the government funding sources, because you'll be able to get so much more. You're able to get lots of things outside of our services as well. Furthermore, it allows us to be able to provide more services for people that don't have the funding or don't get access to the funding. But in short, I think it's really important that we stress that give us a call or refer to us and see what we can do. So you can go to Guide Dogs Australia /members will show your state websites, or just type in your website, your state websites there. You can self-refer, you can give us a call, you can go to the website and attach documents, whatever documents that we have. Would be anything, background and so on would help us as well. So it could be an ophthalmology report or a discharge summary or something like that from a health professional or from the GP. But you can self-refer and refer yourself or a family member. So we would urge that you give us a call and see what we can do. I'm sure in many cases that we can do something for you. And as far as macular degeneration goes, I think we all know how prevalent it is in Australia, and obviously we have many clients with macular degeneration and macular disease. So we have a great deal of experience working in that field. So that's just about it from me. So congratulations, the boring bit's over. So what I might do now is I might hand over to Sally, and she can talk to you about orientation mobility, what that is.
Thanks very much, Laurie. I think I might have turned my mic on a bit early there and possibly muted you. My apologies, everyone. So thanks, Thanks for having me. As we've mentioned, I am team leader of our adult and acquired brain injury mobility services. I've been working as an O&M for about 17 years and 15 of them have been here at Guide Dogs. So I thought I'd start by explaining what orientation and mobility actually is, because it can be a little bit of an enigma. Not everyone knows what it is. So in our world, orientation refers to a sense of position and alignment to objects in your environment, whilst mobility refers to moving safely and independently through your environment. And we like to aim for confident and graceful movement as well. Orientation and mobility is called O&M for short. So I'm going to call it O&M moving forward because it's a bit of a mouthful. And I like to think of O&M as a toolbox really that is filled with skills and equipment that a person who is blind or has low vision can call on or use to move around safely. There's a quote from an academic leader in our O&M field, Dr. Lil Deverell. Some of you may know Lil, and the quote really tries to sum up O&M. So it's orientation and mobility aims to reduce the impact of vision impairment on the individual by increasing their awareness of the environment and equipping them for safe and independent travel. So I'll try and explain a little bit more this afternoon, and I might grab the next slide, please, Laurie. Now that we sort of know a bit about what O&M is, who actually needs it? You know, who can benefit from O&M? And not dissimilar to what Laurie said, I like to think that if your vision status is affecting your mobility, or perhaps preventing you from doing the things that you need to do or that you would like to do, then O&M has the potential to be valuable to you. It's generally a one-on-one service that starts with an assessment. And that assessment really helps an O&M specialist to understand your vision and what effect it's having on your mobility. And so we're really interested in your residual vision as a place to start. So where there is residual vision, we'd like to know what it's like. You know, what can you see up close versus in the distance? How sensitive are you to contrast? You know, how are you affected by changes in lighting as you move around? Is your peripheral vision or your side vision intact, or has that been affected? And of course, we're particularly interested in your mobility. So not your physical mobility like a physiotherapist might be, but more like where are you traveling? You know, and when you do go out and about, how are you managing when you're out and about? Is it easy for you, or do you have difficulties? Are you able to sort of recognize changes in the ground surface? Can you recognize when you're at the edge of a road? And then when you're there, how do you feel about actually crossing the road? Are you avoiding unfamiliar environments because they're a bit more tricky for you? So we go through this sort of assessment process, and it's a you know, a chat with you really. You're the best person to explain to us your experience of your vision and mobility. But it gives us this sort of full picture of you, so that then together we can develop a program to really help with your mobility challenges and build that toolbox with skills and equipment that I was talking about earlier. I think a simple example might be that we establish during assessment that you're able to use your residual vision quite well to travel along a path, perhaps recognise when you're at a step or a set of stairs, but that when you get there, you have difficulty knowing just how deep or how high the step is. And that might be making you feel a bit unsafe, or you might even be avoiding stairs, you know, searching for alternatives like ramps, which can be a bit inconvenient or perhaps even a bit stressful. And so it's possible that O&M training could work to develop some skills, or perhaps introduce a piece of equipment to help improve your confidence on the stairs, and you know, you don't have to avoid them anymore. It could be that we recommend you carry a piece of equipment like an identification cane. I'm going to talk a little bit later about that cane, but you can use it to feel how deep a step is before you step down there. And that can actually, you know, rather than relying on your residual vision, which is perhaps unreliable at not giving you that depth information, you can feel the depth instead, and it gives you a bit more confidence. And so there's lots of examples like that to do with all manner of mobility that can really help improve your safety and your independence and confidence when you're out and about. I might grab the next slide, Laurie. So I expect that many of you would be familiar with some of the O&M equipment. People often refer to the most obvious ones as white sticks. And these white sticks are really the tangible face of O&M. You know, if someone's got one, they've probably had contact with an O&M specialist. They're actually referred to as canes, and there's quite a variety of them. They come in all different lengths and they have different purposes. So the one on the screen at the moment is called the long white cane. And this is the one that most people have seen before. You know, it's used in front of the body. It's usually tapped or swept from side to side. And a really good way to think about the long cane is as an obstacle or hazard detector. So when residual vision isn't sufficient to detect ground surface changes, like steps and road edges, then the long cane can do that instead. So you can feel those changes rather than trying to see them. It kind of presents as a pretty simple device on the surface, but it actually requires quite a lot of skill to use it efficiently and to really maintain your safety when you're using it. I might jump to the next slide. So another cane that we use regularly is the one on the left there, the identification cane. And the name really gives that one away. It's the one that I talked about before that you could potentially use to assess the depth of a step, but its primary use is to identify your low vision to others, to the people around you. And it's really useful for people who have enough residual vision that they can move around obstacles and they can recognise when they're at the edge of a road or at a step, but perhaps they can't see the details. And so this can be really useful in quite a lot of situations. You know, it might be when you're boarding a bus and you're asking the driver to alert you to your stop, or when you ask a tram driver to tell you the number of the tram before you board it. Having something like an ID cane really explains to them why you're asking for that assistance without having to verbally explain it. So also on the screen there is a white support cane. It's folded up, or a walking stick is probably a more familiar term. O&M specialists are not in the business of prescribing balance aids. You know, that's very much the physical mobility and physiotherapist. But if we were to come across someone who's already got a walking stick and we feel they could benefit from identifying their low vision, then we would probably recommend that they replace their walking stick with a white version. Admittedly, it's not as effective or as recognisable as the ID cane itself, but it does go some way to really making others aware of your low vision. Might grab the next slide, Laurie. We've come to guide dogs. What I think Laurie referred to it as the cutest, furriest mobility aid. So you might remember that I referred to the long cane as an obstacle and hazard detector. A guide dog is pretty much the opposite. They avoid obstacles and hazards. They move their handler around the obstacles. They're also trained to do a number of other mobility tasks, such as, you know, walking in a straight line or stopping at the edge of a road, so that the handler can then make a safe road crossing decision. The dog might guide the handler to an empty seat on a public transport vehicle. Guide dog mobility is by far the most graceful and fluid form of mobility, but it's not for everyone, like Laurie said. You know, you can't fold a guide dog up and pop it in your bag the way you can a long cane. It's very much a personal preference. So mobility aids are this really tangible part of O&M. Like I said, if you see somebody with a mobility aid, they've probably had contact with an O&M specialist. But it's really important to note that the mobility aids are not the only skills, and that not everyone with low vision actually needs a mobility aid. There's a lot more to O&M. So I might just move to the next slide. And so beyond the canes and the dogs is this sort of myriad of skills that can help you to move with safety and confidence. And mobility, safe mobility at home is absolute key. You know, it's so very important to feel safe in your mobility in your home. And there's lots of little tips that can help at home. You know, things like just being in contact with the environment, perhaps trailing the wall with the back of your hand or a bench with the back of your hand, or lining your body up with a doorway or an object so that you can move efficiently and, you know, in the right direction within one space to another. You know, perhaps you're the type of person who forgets to close the overhead cupboards and you're always knocking your head. You know, well, there's an O&M skill to manage that. We call it upper body protection, and we can teach people how to, I guess, build a habit of using upper body protection to reduce the incidence of knocking. And I'm sort of holding my hand up in the upper body protection position where I've got my hand in front of my face and my palm facing out. You know, and this is sort of a technique that's also transferable to community mobility, perhaps for overhanging branches as an example. Some other stuff at home that an O&M can advise on, you know, you might have a small set of steps at your back door and you might find it hard to see them well. And so you might be able to improve the visibility on the edge with sort of some contrasting strip that might make it safer and more comfortable for you to see and to navigate those steps. Some other things at home that can really help are things like just keeping your environment uncluttered so that you can really maximise that safe, fluid mobility through your home. You know, and keeping a consistent environment, you know, one that doesn't change every day. You know, objects have a home and furniture remains in the same place. And that can just make it a nice, consistent, familiar environment for you to navigate safely. But of course, beyond the home, there's so many more skills that can be used to maximise safety and confidence with your mobility. And so those skills, they might be about, you know, using your residual vision well. Understanding how your vision behaves in different lighting or at different times of the day can be really useful. You know, it can help you to make decisions about, well, when and where you might travel based on your knowledge of your vision and how it copes in different environments and different times of the day. Some other skills are things like learning to pay attention to the environment, you know, in a different way to the way a sighted person might. You know, when we step out into a busy environment, all of our senses can be just bombarded, and O&M training can really help you to pay attention to the most relevant information, you know, edit out, filter out the stuff that's not useful to you. It could be something as simple as, you know, that distinctive smell of a Subway restaurant on your route home that cues you or reminds you that the next left is the one that you need. Some other stuff for community mobility is, you know, developing safe road crossing practices. It's such an important skill. And, you know, crossing a road with full sight versus low vision versus total vision loss, very different, you know. An O&M specialist can help you to learn where's the safest place to cross the road, and, you know, what are my options when I'm at roads that I don't understand? How do I recognise the edge of the road? How do I line myself up so that I actually travel in a straight line and I cross in the direction I want to, perhaps rather than the direction that the pram ramp is pointing me to, which often is into the intersection instead of across the road. Road crossing skills are hugely important, and there's even just little tips like if you're walking along a busy road and you need to cross a side street that comes off the busy road, sometimes just walking down that side street, you know, down to the second driveway or so, can really reduce the noise that you have to filter to make your road crossing decision, and it removes the need to have to think about the cars that may or may not be turning into or out of that side street. So you go down the side street, you get to make a more simple, calm, less stress road crossing decision, cross over safely, and then you're able to come back up and continue on your way along the main road. That's, you know, a simple tip that can make a big difference to how, I guess, how calm you might feel along your route of travel. Another tip that I love at road crossings is to maintain control of the crossing. So you've probably all experienced when you're perhaps waiting to cross an uncontrolled crossing, so no lights, no zebra crossing, you just need to cross, and a driver might pull up and wave you along. And now you might not be able to see that driver, but you can probably make an educated guess that that's what they're doing. But in doing that, you could be wrong. They might have stopped for another reason that you're not aware of. And so by sort of maybe stepping back from the road crossing and waving the car on, you've taken control of that crossing decision and maintained your own safety. You haven't sort of handed your safety over to someone who you're not quite sure what they might be trying to indicate to you. So little tips like that can make something that's stressful, crossing a road with low vision, a little bit more simple. And of course, there's a lot more complexities to it than that. And if you are having road crossing difficulties, then O&M is definitely something that could support you. Another area of orientation and mobility is planning and problem solving. You know, it can be really important for community mobility, and it could be just as simple as using, you know, transport timetables in advance or maps in advance to plan out where you're heading and what your day is going to look like. It might be about having a plan B in case it doesn't go to plan, or giving yourself permission and time to stop, think, replan when something isn't quite as you had hoped or expected. And so there's a lot more involved in O&M, but obviously there's not so much time to cover it all. But think things like public transport, you know, navigating different environments, quiet ones, busy ones, shopping centres, open spaces, using escalators, managing stairs, we've talked a little bit about, going into the city, or all these sorts of things are what O&M can help you to do in a safe way. And there really is this sort of true depth to the skills that you would use to navigate your environment safely and efficiently when you've got low vision. But just having access to those little tips and some equipment can make a world of difference in helping you to do what you want to do and what you need to do in a safe, confident, independent way. And as I said earlier, we always aim for a sort of graceful movement as well. So that's really O&M in a nutshell. So I might actually throw back to Sabine.
Thank you so much, Sally. That was a fantastic talk and a really great reminder of some really simple concepts, but really useful concepts when it comes to road crossing particularly. So I would like to just remind everyone that if you have any questions, you still have time to submit those via the panel from before. Remember, you can enter your question at the bottom of that box and send it to us and we'll address it in a minute. But firstly, I'd just like to talk about the Macular Disease Foundation. You know that we were established in 2001 and our main focus is to reduce the incidence and impact of macular disease in Australia. And that's all types of macular disease, not just AMD, but also diabetic macular edema and other types of diseases. We do that through 4 pillars of work: prevention and early detection. Obviously, we would like to catch people early and if possible, even prevent them developing any type of eye disease. And we do that by raising awareness of disease and encouraging people to get their eyes tested early so we can pick it up early. We also, of course, through our second pillar, provide supports and services, which I'm going to talk about a little further here. But the idea is that we can support people living with macular disease to continue to live their lives well. The third of the pillars is that we are, of course, the voice of the macular disease community, and we're very proud to be able to represent all Australians with macular disease at the highest level and try to ensure that people can access publicly funded treatment and support. And of course, the last of the 4 pillars of our work is research and data. All of the money that is donated to our research grants program ends up funding research projects all around Australia. And since 2011, we have funded $4.1 million worth of projects, which is 21 different projects around Australia. All of our brochures and information, of course, is evidence-based. In terms of support, our national helpline is, of course, the centre of all of it. At any time during business hours, people can call and ask questions on a range of subjects, including eye disease, peer support groups, low vision services like we've discussed today, access to clinical trials, information about government services like My Aged Care, NDIS. We have an interpreter service available, so if English is not your first language, we can arrange for help. And all of our publications are available in 7 different languages. If you are keen to receive any of our information or access any of our services, you can go to our website, www.mdfoundation.com.au, and as you know, you can access that all at no cost. Now, I'd like to bring back both Laurie and Sally now to answer a few of our questions. There we go. I'm still waiting. There we go. So let me just have a look. We have a lot of great questions and we will work our way through them. So Sally and Laurie, are you ready to go? Excellent. So do you have an online shop where I can view different low vision aids is one of the first questions.
Sally, did you want to? So, you there, Sally? You're on mute.
Sally's on mute.
So, look, we don't have an online shop as such that you view. You could, I suppose, view that anywhere there. So, but I suppose what it's always good to get is from one of our practitioners. Okay, what is the aid that you're actually looking for as well? What's the best one for you? You may go and browse online, but you may not be able to know which one is the best for you. So I think it's always good to get that professional advice as to what you actually need before you then go and search and buy something.
There's a good example of that in mobility, where there's very specialised equipment for sort of GPS technology. It's very good equipment and it suits the needs of some people, but it's also expensive equipment. And so by linking in with a specialist, we can look at, is there an alternative to meet whatever your challenge is? You know, it could be as simple as Google Maps on a phone that you've already got. So that's a good example of when just checking in with a specialist to talk about your needs can make a difference.
That's great. Yeah, sometimes Siri is a huge help. I have quite a few patients who love Siri for that reason. They can ask her to do anything.
Indeed.
Who can refer patients to guide dogs? Can a family member refer?
Certainly, anyone can refer. So we have a range of people that refer to us. You know, there might be, you know, there's various health professionals like OTs and so on, but we also get referrals from, you know, self-referrals and also from family and friends as well. So yeah, anyone can refer. So you just go to your state website, you can either give us a call or go online and attach the documents and things like that as well.
Thanks, Laurie. Do you have to have a certain level of vision loss to have a guide dog?
That's a good question. No. So as Laurie pointed out, a large percentage of our clients have residual vision, and that includes a large percentage of our guide dog handlers. It's very much based on your, I guess, the impact of your vision on your mobility, and can guide dog mobility, is guide dog mobility the right solution for those challenges? And so it's just everybody's assessed individually. Everybody is entitled to, you know, receive information about guide dog mobility to help them make a decision. Everyone's entitled to an assessment, and they get a really thorough process with our guide dog mobility instructors to conclude if the dog is the right aid for them.
So you were just referring to the low vision assessment. People are wondering, are they actually taking place in Victoria at the moment? And are you doing those via webinar or other means?
Yeah, that's a good question as well. We obviously in Victoria, we're in stage 4 lockdown, and so we are restricted to delivering services that are considered essential. And so it's probably fair to say that a low vision assessment at this point doesn't fit into that category. And of course, it's a risk going into people's homes, but we are doing everything that we can to deliver telepractice. So we're taking assessments as far as we can on telepractice with a view to then being able to see people face to face. Telepractice has been quite eye-opening for us as service providers. You know, it's been really wonderful to see that it does have a lot of applications, and we're excited about it, and we know that it will continue to be part of our future, but face-to-face obviously is preferable in many instances. I don't know if you have anything to add, Lauren.
No, I think that obviously we'll do thorough risk assessments, not only for you know, the clients, but our staff as well. But yeah, I think you're learning so much more about how far we can go doing it online. But I know that you do still do some face-to-face, and it won't be long before we get back out there again, I'm sure.
Yeah, absolutely. And certainly in the acquired brain injury space, there's some low vision assessment work that we do that is very much paper-based. And so where telepractice allows, we actually post those assessment packs out to the client, and then we do complete the assessment via telepractice, and that's been quite successful. So we're definitely pushing the telepractice boundaries as much as we can.
And I'd say that also, if you're thinking about you know, referring and getting services, you know, don't hold off going there now, because we can still assess, you know, make some assessments of where you're at and so on, and get all the details down and be ready to go.
Thank you for that. I think telehealth has been a great addition to services all around Australia, and I think particularly for people who are remote or have mobility issues, it'll be great to retain some of those services for the future. Another question around that is there a cost for that low vision assessment?
Oh, no, there's not. So just as far as cost for services, there's no out-of-pocket expenses. So it either gets covered. It either gets covered by your the government funding source or by our fundraising. The only things I suppose you would pay for, Sally, would be, you know, maybe some equipment if you actually needed to buy some actual hardware and things like that as well. I know that if you're with My Aged Care, if you have a home care package provider, I think they sometimes charge a contribution charge or a co-contribution and things like that. We don't charge it, so that cost doesn't come from us. We don't charge any co-contribution, things like that, but you'd have to check with your home care package provider with them of how they do it. But no, there's no out-of-pocket expenses for our services. So if you get a guide dog, for instance, they can cost well over $50,000 to breed, train, and raise, and all that sort of thing. You don't pay, you know, for any of that.
That links nicely to another question, Laurie. So the cost of items that you might need for vision enhancement, so like a screen magnifier, is that cost subsidised, or are they full retail price?
So Sally, you could chip in there too, but I suppose that we'd be looking at, if you have that funding source and things like that, you can usually get that covered, especially if you're with NDIS or something like that, then they can cover that. If you're not with any, then you know, it really does depend. Sometimes we get grants, don't we, Sally, with that can sometimes come with that, and we can get that there.
Yeah, where funding doesn't exist, it's a little bit inconsistent. So, you know, part of our job roles is across the services that we have is to justify to funding sources why you might need a piece of equipment. And so we spend time having those conversations and writing those reports. But as Laurie said, where funding doesn't exist, our philanthropic dollar doesn't extend, or it very rarely extends to providing pieces of equipment to our client base. We sometimes get grants where we might have a certain number of magnification aids that we can distribute appropriately, and then often there's, you know, there might be boundaries around who we're able to supply that to. So as an example, we would never provide one of those to someone who's got NDIS funding and they can access it through their funding. It's really about being able to try and provide equipment to people who don't have access to funding and can't afford the equipment themselves.
Yeah, and that's a good thing to remind too, as about, you know, if you are able to apply for certain funding, then please, you know, do so, I think, because you will be better off.
Yeah, so touching on that, Laurie, there's another question. Is my aged care only available for pension holders? This might be a little bit outside your remit. Are you, either of you able to answer that question?
Well, I'm not an expert, but I don't believe, no, you wouldn't need to be a pensioner. I think they're, put it this way, I don't think Gina Reinhardt would get it, but you know, there is, I think there are some sort of means testing, but look, I know people that are, you know, fairly comfortable and things like that, and can get home care packages and so on as well. So yeah, and I don't think, and if someone's getting a disability support pension, that doesn't affect, none of this funding affects that either.
Right, thank you. So I think we have time for one last question. Does Guide Dogs provide home modification advice for low vision clients?
Sally?
I was waiting for you to answer. So that's very much an occupational therapy area. So OTs provide home modification advice. From a funding perspective, no, our OTs, we are not registered with the NDIS, for example, to provide large scale home modifications. I believe that we can provide you know, more general advice to you around perhaps contrast and lighting, but not large scale home mods.
But I know our OTs, certainly they'll be able to advise you what to do. You know?
Fantastic. Thank you so much for taking the time.